It's just after 20 past 7. Good morning to you. Now, the number of children needing help for eating disorders is at crisis point. Waiting lists in England are at record levels. This is according to new figures.
Yes, the Royal College of Psychiatrists says lives are being put at risk. Let's take a little closer look at the situation. So between October and December 2021, more than 1,900 young people were waiting for routine treatment, the highest number on record.
Now, more than 200 young people were waiting for urgent treatment, the second highest number on record. And just 59% of patients started urgent treatment within 1 week, well short of the government target of 95%. Well, we're joined now by one of our regular GPs, Dr. Helen Moore. Morning.
Hi, good morning.
And we've got the actress and campaigner Gemma Oaten, also a familiar face to this programme. Hi, Gemma, good to see you. Thanks for the wave. Gemma also had her own struggles with anorexia when she was 10. And Gemma, the reason we're talking to you as well is because you have often spoken about the difficulties in getting treatment. And, you know, these figures today showing that they're falling well below government targets for younger people who are struggling with eating disorders.
I think, Nada, we've spoken 4 times over the pandemic about this now, and I'm just wondering, when do we have to reach a peak for actually action to be made? 27 years ago, I was in the same position. I was taken to the doctor by my parents. I was turned away because I wasn't low enough in weight to have a problem, apparently, which is nonsensical because an eating disorder is a mental health illness. It's not about weight. And then in a year and a half's time after that, I was given 24 hours to live, admitted to a children's psychiatric unit. And that was my life for 13 years. Our kids deserve better and more needs to be done.
Yeah, Dr. Helen Moore. That was Gemma's experience years ago, and still we're talking about, and we understand, of course, the pandemic has set back services across the NHS.
Absolutely.
But to be so below target and forgetting the targets, children aren't getting the help they need.
No, it's very disheartening, isn't it, to see our children in this position, and I totally agree with Gemma. It's not acceptable as such. Unfortunately, the pandemic has put everything back years, if you like, across the system. And, the pandemic's been really hard for young people. It's increased all mental health illnesses across a wide range of scope. And I think, Gemma made a really good point. This is a mental health illness, an eating disorder, and it is really key that we understand the seriousness of it.
So can I ask, Helen, so say a family or a young person takes the very brave step of coming to see you as a GP. Maybe it's the first time they've sort of acknowledged it. And they come in and they see you and they think they've got a problem, and you can see there is an eating disorder issue, real concerns. What can you do? I mean, we're hearing all the times about the pressures on the service, the facilities available. Are you able to offer them anything other than, your professional experience and your advice? But beyond that, what is available?
Well, we are still referring into these services, so it's not that the waiting list is high, so it's closed. We are still referring, but as you've mentioned, the wait times are considerably longer than they should be. So for an urgent referral, they should be seen within 1 week. Those, if you look at the pre-pandemic levels, those figures have gone up 72% in number of people needing to be seen urgently. So hold on,
just help me with that one. So you get an urgent referral. So that is obviously an immediate risk. So that would have been a week, and what would be happening now?
You'll be waiting longer than a week, and the routine referrals have gone up 36%. So, that we are in crisis across a wide range of mental health services for children. We are relying as GPs more heavily on charities such as Beat, the anorexia charity and other charities as well, to try and support people. It's not ideal, but what I really would stress to people is still please come forwards. If you are struggling, don't see this waiting time as a reason not to come forwards, because we need people to tell us, and we will advocate for those patients and push for treatment.
I mean, the thing that shocked me is this urgent. There are more than 200 young people waiting for urgent treatment. What's urgent?
So urgent is when we think they need to be seen within a week, and urgent in terms of, really sort of affecting everyday life, so affecting their ability to get on with relationships, affecting ability to school, affecting their ability, their mental health to sleep, etc. So there's all sorts of reasons why someone might be urgent. It's not all about weight.
Gemma, I think Dr. Helen Moore made that point. I know, I can see, I've seen that face of yours before.
Okay.
You know, go on.
Ellen, this is in no way disrespect to you at all. I completely agree with what you're saying. Your services are pushed to the max at the moment, but early intervention is key. And then these kids don't even need to go on waiting lists. These kids don't even need to have to wait 5 months before they get to crisis point and then end up in a hospital
But Gemma,
bed.
sorry to interrupt, isn't the point, I mean, Dr. Helen Moore made the point that come see the GPs, absolutely, they're not referring, that the referrals are being made, it's about the services the other side which aren't available.
Yeah, exactly. And that's where we need to start to look at the restructuring of where the money's actually going. As Agnes Ayton said from the Royal Psychology and the Faculty for Eating Disorders, you know, this money's being pumped in, but it's not getting to the people that need it. Right at the start, the community services. Like Helen said, yeah, there are charities like Beat, there are charities like Seed, there's Supported, there's First Steps, but there's only one charity that gets a bulk of that money from the government, and that's Beat, and they do an amazing job. But there are so many others like Seed who have got eating disorder educational toolkits, we've got recovery programs, but yet we turn around in the CHCP cut our funding, and we're the first port of call for those people who desperately need us. But if we look at working together and not just thinking NHS who can't cope as it is, and the poor GPs, because they need more education, but they haven't got time to even think at the moment.
Okay, Gemma, can I just ask one thing? I think it's important, and we've talked to you before, and your messaging is very clear on this, but it's also important that there could be people watching today, watching us now, who've not spoken to anyone, maybe haven't even spoken to their immediate family. The first steps, given what you say about how quickly things can get very bad, those first steps, even leaving aside the work of GPs in the medical profession, talking to someone at all is really important, isn't it?
It's really important, it's really brave, and it's the biggest step that anybody can take. And I think as much as I am passionate and I get wound up about this, there are amazing people out there who are willing to listen, but also there are 1.25 million people in the UK alone who are suffering from eating disorders. There's no stigma around this, there's no shame. We need to normalise the conversation. And I think that first step towards recovery is being brave and opening up and knowing that there will be people, even though we're talking about the negative side of things, there are lots and lots of positives and there are lots of people willing to listen. Helen sounds like a wonderful GP, and there are many more wonderful GPs out there, and there are also charities.
Gemma, it's always good talking to you. Thank you so much for sharing your experience, always. And Helen, thank you. You get a little bit of a nod at the end there. And
I do know it's difficult. We're frustrated as well as GPs. Yeah. It's really sort of hard to see somebody suffering like that and not be able to just plug them straight into a service.
We will no doubt talk about this again, of course. Thank you very much, Gemma. Thank you to you as well.
For details of organisations which offer advice and support with eating disorders, you can go online to bbc.co.uk/action line. There will be a list of organisations which can help you, and numbers, of course.